other chief executive officers to update you in terms of what is taking place, in terms of the achievements, in terms of highlighting areas that might need clarification, as we have generated a platform of openness and transparency brought about by the leadership of President Edi Mnangagwa. So in addition to this press session, you also have a quarterly presidential interactive session where on a quarterly basis you'll be able to interact with His Excellency President Edi Mnangagwa. But for today, we have this government meets with the media to ask any questions that you might be interested in related to water and sanitation, related to cholera issues, also related to the interventions that the central government has been in a position to implement since we have been having a lot of challenges from the city councils, and in particular Harare Metropolitan Province, which has a lot of deficiencies in terms of ensuring that we have a safe, clean environment. So the central government, under the leadership of President Edi Mnangagwa, has managed to implement a number of measures in order to ensure that we have a practical, achievable, solid waste management plan under Ministry of Environment. And we has also appointed Honorable Dr. Encias Jongwe Masuka as a committee chair in charge of the WASH sector, focusing also on Harare Metropolitan Province. And we also have the Minister of Health and Child Care, Dr. Mumbeshora, also to highlight and clarify issues related to cholera and what central government is also involved in order to arrest some of the challenges that we currently have. But all this, as I've indicated, that the background is the failure by the city fathers, the failure by the city councils to be able to play a very important role in the management of affairs in the city of Harare. But also Dr. Masuka will highlight other interventions in other cities. We also have directors from other ministries who also support what the committee chair, Dr. Masuka. So I'll start with Dr. Masuka. Dr. Masuka, over to you.
Well, thank you very much. I will give a brief overview of the water, sanitation, and hygiene sector in my capacity as chair of the Inter-Ministerial Committee on WASH. You will recall that access to water and sanitation are constitutional rights as enshrined in Section 77 and 73 of our Constitution. And the President has eloquently declared his vision for Zimbabwe to become a prosperous and empowered upper middle income society, leaving no one and no place behind. And it is in this vein that a very elaborate structure has been put in place to address WASH issues. There are 5-6 ministries involved: the Ministry of Health and Child Care, the Ministry of National Housing and Social Amenities, the Ministry of Local Government and Public Works, the Ministry of Primary and Secondary Education, the Ministry of Finance, and the Ministry of Lands, Agriculture, Fisheries, Water, and Rural Development. Also, the Ministry now of Environment, Tourism, and Climate. So this WASH sector is responsible for the coordination of all government activities in the water, sanitation, and hygiene sector. We have, for purposes of implementation, a working party of permanent secretaries and groups and subcommittees. We have a subcommittee that focuses on urban WASH issues. We have a subcommittee that focuses on rural WASH issues. We have a subcommittee that focuses on WASH in health. We have a subcommittee that focuses on WASH in education, which is why you have seen that we've been able to open schools without any issues. These are all task-oriented committees, subcommittees, We also have one that we mobilize when we have emergencies, such as the one that we've mobilized when we had the cholera outbreak. Under the 21 or so working groups that the ministry has, we have now a watch sector working group that also meets quarterly and involves all the 92 local authorities and interested stakeholders. So should you want to tune in to that meeting, you will be given a link by the acting director of WASH, Shiruhuru there. He can give you that link. A meeting will be held shortly. So the Secretariat of the National WASH Committee is the Department of Water, Sanitation, Hygiene Coordination. And this is resident in the Ministry of Lands, Agriculture, Fisheries, Water and Rural Development. So outside these interactions that we are having, should you wish to get any clarification on any aspect relating to WASH, Nesbet Shiruhuru, can you stand up so that they can see you? That's the Acting Director, National WASH Coordination, reporting to the Chief Director, Water Resources Development, Irrigation, and WASH, Chief Director, Engineer Mutazo. So those two are the culprits. So, according to the Water Act and Zinwa Act, we have the regulatory functions relating to water, some of them still with the Zinwa. You will be aware that we are currently reviewing both the Water and Zinwa Acts to ensure that there's a separation of responsibilities and powers, that all the regulatory functions will now come to the Department of WASH Coordination. And in that vein, we are also going to have a provincial structure. Currently, they are only represented at the head office, and this coordination mechanism for WASH, which goes to the local level, is actually done through other government agencies, RIDA and the rest of them. But just to indicate that the rainy season is upon us, we've seen a very substantial improvement in inflows into the major dams. We are currently at 81.7% full across the provinces, compared to about 63%, which would be normal for this season, although there will be variations from catchment to catchment, the Mzingwane catchment being the worst affected. Mat North and Midlands are the provinces that have the lowest inflows at this stage, but we still expect that they'll be able to get additional inflows. Once we have these inflows, we monitor on a daily basis 32 urban councils' water supply situation, and should you want to get any update, you can get these updates from the Department of WASH Coordination. There are quite a few dams that have filled and are spilling, which is good news. But the focus for 2024 in terms of urban WASH on a mega scale for central government are the two metropoles, Harare and Bulawayo. And in particular, Harare, to complement the efforts by the city of Harare to provide safe water and sanitation and hygiene to its residents. The president directed that we assist them by seconding a technical committee, and that technical committee is chaired by Professor Makurira of the University of Zimbabwe. We gave them a 100-day mandate. We have extended that mandate. We wanted them to increase daily water supply to 520 megaliters a day. We are currently hovering around 350 megaliters a day, and the government has availed resources to kickstart this process. $1.6 million has been disbursed for the purchase of critical chemicals by the city of Harare. An additional $13 million is being looked into by the Ministry of Finance, Economic Development and Investment Promotion, so that Harare's water woes can be eliminated. We are also, in the context of Harare, looking at two additional water sources. You recall that the president launched the Muchekaranwa Commission, the Muchekaranwa Dam, and the pipeline that leads to Wenimbi Dam, just outside Marondera. We want to accelerate that project so that we can get water from Wenimbi to eventually flow into Arava, and then we'll be able to maximize the utilization of Prince Edward Works at 75, 78 megaliters a day to be able to supply the Chitungwiza municipality, whose requirement is about 70 megaliters a day. We are also looking at an aquifer that that has been found in the Seke area to augment that. Then downstream 2026, 2027, we expect Kunji Dam to come on stream to be able to supply an additional 200 megaliters a day, and the central government is building that dam, the conveyancing pipeline, and also the treatment works to assist the city of Harare. And in the expanded the scope of works, we've seen that 80% of the raw water, of the treated water intake, eventually becomes wastewater. And we have seen that in the case of Harare, there's lots of pollution, and we have to use 16, 17 chemicals to clean the water at Lake Chivero before we can utilize it, simply because of the pollution that's taking place. Government is considering widening the scope of works to include wastewater management for some of the major projects that we are currently undertaking. You will hear stories about Dawendel and its ability to supply water. We currently have only one pump working at Dawendel out of 5, and we can't decommission that at this stage because we are using that water to dilute the polluted water in Chivero so that we use fewer chemicals to be able to conveyance that water. I'll stop there for Harare, but for Bulawayo, yes, government now has availed another $7 billion for critical repairs that are required at Mzingwane, and also for the purchase of other critical materials. We want the Epping Forest 20 megaliters per day generation capacity to be operating optimally at about 16 megaliters a day, and then we give 4 megaliters a day to the farming community. So there are interventions in Bulawayo to ensure that we can get to the 155 megaliters a day against their demand indication of 175 megaliters a day. And Bulawayo City is far better than Harare in terms of managing its chemical supplies. They do have adequate supplies. In fact, their stock ordinarily lasts 3 months, whereas Harare generally has less than a month stock of chemicals. So these are the interventions that government wants to see. There are discussions with a technical committee that we've appointed for Bulawayo, and that technical committee has presented its first report. We have said they should look at it in the context of the long-term supply for the city of Bulawayo, which, as you now know, depends on Gwai Shangani. Gwai Shangani, the lake is at 70% completion. The pipeline is 252 kilometers. We have done 139 kilometers of bush clearance and a bit for trenching. We've done a proof of principle for the laying of the pipes that are about 1.2 meters in diameter. At full capacity, we'll be able to conveyance from Lake Gwai Shangani to Bulawayo 220 megaliters a day, and Bulawayo will have enough water to last the next 8 years. So that's the intervention by government at the urban wash sector. I wanted to raise Zinwa. Is anyone from Zinwa here? Zinwa, which is, as you know, a government entity, supplies water from its 534 treatment works across the country to various service centers in the smaller towns. What we want to see increasingly is that any urban local authority be capacitated to take over and run its own activities, such as happened in Bout Bridge and also in Gwanda. Regarding the rural wash sector, there are many development partners over the decades that have put boreholes in rural communities, with DDF, now RIDA, also doing similarly. But we have never had a coordinated national approach which the President, Dr. Idi Mnangagwa, put in place. So we now have Rural Development 8.0, whose one component is going to be life-changing for the many rural residents. This is drilling 35,000 boreholes in 35,000 villages. To date, 2,600 boreholes have been drilled across the provinces. We also, under the Schools in Wash program, are going to be drilling 10,000 boreholes at 10,000 schools to ensure that there is safe water and sanitation. And along that, in terms of empowering the youth, we are going to be establishing 2,400 centers throughout the provinces. In terms of communication and what you probably would like to do and get a link to see the progress that government is making in terms of provision of rural wash infrastructure, we have a rural wash information management system. This is now operational in 51 of 60 districts and in 7 out of the 8 provinces. So you can see the elaborate wash program where the water points are operational, where sanitation is available, where it is not available, and then you can interact accordingly. There's been an outbreak of cholera, and the Minister of Health and Childcare will be able to give you the latest statistics. The wash sector has responded by concentrating on drilling of boreholes, ensuring that the water is safe, and the Minister will be able to provide additional information. I highlighted earlier the existence of a wash in schools subcommittee, and this subcommittee has enabled the safe opening of schools, as you will have noted, compared to other jurisdictions in Southern Africa. The wash in health will be reported on. We have seen efforts to improve sanitation in the urban areas, and the Operation Chenesai Harare has been launched and will be now be on a more nationwide basis. This is in addition to what the Second Republic did when it came into office to launch the national cleanup every first Friday of the month. And if we adhere to that, certainly a cleaner environment will eliminate some of these diseases that we now face. I would like to stop here in terms of just providing the very broad overview of how government coordinates activities in the wash sector, and to allow the Minister of Health and Childcare to come in and give you the cholera-specific interventions. And after that, if there are other questions, I will ask the senior officials from the various ministries to come in and just give very brief updates, including Ministry of Finance, Economic Development and Investment Promotion, to just indicate the resources that have been availed. But all this, in conclusion, is indicative of a government that is sensitive, that is desirous to establish a safe environment for citizens to thrive. Thank you, Chair.
Thank you, Dr. Masuka, for the elaborate statement in terms of what the government under the leadership of President Idi Mnangagwa has been able to achieve. And this is part of a whole of government approach where we coordinate all ministers to be able to meet with the media. So for now, I'll hand over to Dr. Mombeshora so that you can also give a statement. And thereafter, if there are any additionals from the other senior government officials, then the media can then be in a position to clarify the issues that the respective ministers have been able to issue statements regarding wash, cholera, the environment, and the financial interventions that the government has been able to achieve. Dr. Mombeshora, over to you.
Thank you. Good morning, everybody. Let me start by thanking the chairman for the WASH program, who has given us a very detailed report. Thank you, Honorable Masuka. I'm going to talk more on the cholera side, which is my responsibility. And I want to urge you, reporters, please to listen carefully and get the correct information. We have had challenges of people making wrong reports, even at some international fora, where there have been claims that in Africa only Zambia and Zimbabwe have got cholera cases, and yet we have got over 37 countries in Africa that are having cholera. So it's throughout Africa, it's not only in Zimbabwe and Zambia. Having said that, I'll give you the cholera situation as of 23rd of January 2024, this year. Our cumulative suspected cases are now 20,121. And I want to emphasize that we are talking of figures that have been recorded since the beginning of this cholera outbreak in February last year. That is February 2023. So these figures are covering a period of almost 12 months. We are just about a month to end of February. And I also want you to note that I've said suspected cases, because we are now treating any diarrheal case as cholera for management purposes, so that we don't delay managing and lose lives. Otherwise, we take time trying to make a diagnosis, taking specimens to the lab to say, let's confirm, and we lose lives. As a result of our intervention of taking every diarrhea case as a cholera, we've managed to have a very low case fatality rate compared to other countries in Africa. Our case fatality rate at the moment stands at 1.8% or per 100,000, whereas in other countries it's much, much higher than that. And WHO accepts a case fatality rate of 1% and less. It means our management for the cases is quite good, despite having all these diarrheal cases. Again, when it comes to deaths, confirmed and suspected altogether, they are coming to 447 cases since February last year. The confirmed are those that will have had specimens sent to the lab and confirmed to say it's cholera. But most of our cases are suspected because they would not have been confirmed in the lab. In the last 24 hours, we had 6 deaths, and I think that is quite a lot. Any death is not acceptable. In care, that is those who are admitted in our cholera treatment centers and at Beatrice Road Infectious Disease Hospital, there are 232 throughout the country. And at the moment, 60 districts in Zimbabwe have been affected with various degrees. Some have got 1 case, some have got hundreds of cases. That's the difference. But as long as we have had a case in any district, we record that we have got a case in that district. Hotspots most affected are in Harare, Chitungwiza, Buera, Gutu, Chiredzi, Mazowe, and Mbire. These are our hotspots. Active cholera treatment centers countrywide that we have established are now 153, with Masvingo province having 56 on its own, Manicaland 54. Harare has 4 huge cholera treatment centers, and also Beatrice Road Infectious Disease Hospital has been designated for treatment of cholera. Other infectious disease cases that were managed at Beatrice Road are now being dealt with at Wilkins. So we have left Beatrice Road specifically for cholera cases. We have 949 cholera beds available in Zimbabwe, and we have set up 33 oral rehydration points throughout the country. Most of them are in the rural areas. The determinants of cholera outbreaks in Zimbabwe are centered on safe water provision, which is intermittent and not adequate, both urban and rural. Sanitation coverages which are low, best sewer pipes in urban areas, refuse collection which is intermittent, and more recently climate change coupled with flooding and droughts. The recent surges around festive season were caused by gatherings, religious or otherwise, attendances to funerals, as well as movements in artisanal mining areas. To mitigate against the ongoing cholera outbreak now affecting 60 districts, my ministry duly activated the incident management system and appointed an incident manager. And I would want you to know the incident manager is sitting right there, Dr. Piri, if you can stand up so that they see you. He is the point person and coordinates all cholera activities in all provinces. And he has got the data on his fingertips. He is the man to ask for all the specifics and what is happening on daily basis, because he gets the data before he briefs me. So he will have the information that you all require. We also have our public relations department, and Mr. Mjiri, can you stand up so that they can see you? I know most of you have got challenges getting to me because I always keep my phone on silent, and when I'm in meetings, I don't answer calls. So he is the man to talk about information, all information you need from the Minister of Health, Mr. Mjiri. Having appointed him, he is supported by response pillars of WASH, surveillance, laboratory, case management, and infection prevention and control, risk communication and community engagement, logistics, supplies, and finance. These pillars are working every day to respond to the outbreak, and this is replicated at sub-national levels where we have the deployment of the national and sub-national rapid response teams. So this coverage goes down to the ward level. Everywhere we get information on daily basis. We are continuously setting up cholera treatment centers where these cases are being reported and treat the cases from these cholera treatment centers. There are 153 active cholera treatment centers throughout the country to accommodate cases and treat these cases at source. Our rapid response teams, when they are called to respond to cases, be it in the community, at a household, or under a tree, or at a bus terminus, they work at the site to stabilize cases even before a camp is set up. I am mentioning this because there was an article which was on social media somewhere in Chirezi where they were saying this is how we treat cholera cases under a tree in Zimbabwe. We don't take cholera cases into a hospital because they will contaminate the whole hospital. So, as I said, that the funerals, gatherings are becoming the problems. So, you have a village having had a funeral and you have 10, 20 people with diarrhea coming to report at a health center. We do not take them into the wards, but we have to start stabilizing them outside whilst a cholera treatment center is being put up. For that case which was reported in Chirezi, actually 2 tents were set up and there's a spare tent as we speak which is not filled. But it helped to stabilize the patients before the center was set up. Most important is to know that what kills with cholera is the dehydration, loss of fluids. That's why we say we are setting up oral rehydration points. Somebody has diarrhea, the first thing is give fluids, as much fluids as you can. What kills is that dehydration, loss of fluids in your body, and you start having chemical disturbances within the body, and that is what kills. So I mentioned at the beginning that our case fatality rate is very low. It's because of these early interventions that we do at the place where we have picked or where the cholera cases have been reported. We discourage movement of patients from place to place, because all the way, as the person is moving, usually they are actually passing their diarrhea, watery diarrhea. The whole place becomes contaminated. Therefore, early management is very, very important. The cholera treatment centers are equipped and resourced with supplies operated by health community workers dedicated specifically to manage cholera cases, while other clinics or hospital services continue to operate and are not disturbed. We are setting up oral rehydration points in the affected communities to offer urgent rehydration to cases in the community before they are transferred to cholera camps. These oral rehydration points are operated by trained community members who will give oral rehydration salts to the affected as they wait to go to a cholera treatment center, and will reduce complications due to rehydration and will save lives. Engagement of other government ministries and departments in the fight against cholera is key and assists in the response using the whole government approach through the setting up of this interministerial committee, which has been discussed by Honorable Minister Masuka. Through this committee, Operation Chenesa Harare has been initiated to rid Harare of the garbage that has been piling up in the streets, communities, and markets. To mitigate against cholera, we advocated for the increase in potable piped water provision at the household level, and we had dedicated Zesa line repaired so that water supply is not interrupted at the Morton Jeffrey Waterworks. Where there is no council water, alternative sources such as water tracking and drilling of more boreholes in the hotspots are being done. As Minister of Health, we had a program to make sure that all our health facilities in the rural areas have clean water, and we have drilled more than 300 boreholes throughout the country. But during the recent outbreak in Buhera, we drilled 14 boreholes in Buhera district alone, and the WASH program also drilled 30 boreholes. So it's one of the most important things that we have to do to provide safe water to the communities. More will be drilled in this current financial year. We are not yet very sure how many we are going to be able to drill, but the program is ongoing. Furthermore, we have provided commodities such as jig, aqua tablets, and water guard to strengthen point of use water treatment. The ministry successfully mobilized the release of $12 million equivalent to support procurement of medical supplies, laboratory consumables, food allowances, and trainings at all cholera treatment camps as we respond to this cholera outbreak. We are also working with our partners from WHO, UNICEF, and others for additional support and prioritization of funds towards cholera response. We continue to engage with traditional leaders, religious leaders from various church denominations, community leaders in the affected areas, for them to play a role in cholera prevention and control initiatives. We have reached out to those in Marange specifically because that was the area that was hit hard by cholera in the early stages, and we have made tremendous progress, and we appreciate the response that we have received from the traditional leaders as well as the church leaders, especially from the apostolic sect, who have accepted to treat drinking water and also to report to our clinics any cases of diarrhea as early as possible. These include allowing their followers and people under their leadership to report early for treatment, adopt cholera prevention measures that apply to them in their communities, working with Ministry of Health and Child Care officials in a collaborative way. My ministry is working with the Ministry of Information, Publicity and Broadcasting Services to engage the media, including local community radios, in the dissemination of health education messages to the populace, in addition to our teams on the ground giving health education in the districts. To that effect, we have benefited slots on radio, TV, and social media platforms. Our ministry has successfully applied for the allocation of oral cholera vaccine from International Coordinating Group on Vaccine Provision. The decision to allocate 2.3 million vaccines was made on 12th January this year, with the initial 892,286 doses coming into the country by January 28th this year. The vaccination campaign is expected to start from the 29th of January in phased approach to the hot spots. This is because the doses are not enough to cover the whole country, so we've targeted to start with the hot spots and then roll on to the other affected districts as we receive more vaccines. The challenge is that there is a shortage of the vaccine in the world, because cholera is not in Zimbabwe alone, like I said in the beginning. So all other countries that have reported cholera are also getting the same vaccines from the same source. So it's now controlled by WHO to make sure that all the countries can get something. Otherwise, only the rich countries will wipe out the vaccines before others get them. We will be targeting hotspots areas, also known as prioritized areas, for multi-sectoral interventions where cases are being reported currently. These areas include targeted districts in most affected provinces of Harare, Manicaland, Masvingo, Midlands, Mashonaland East, Mashonaland West, and Mashonaland Central. Specific provinces the districts targeted are Mtare Rural, Mtare Urban and Buhera, Gutu, Chiredzi, Mwenezi, Mberengwa, Zvishavane, UMP, Kariba, Mazowe, Mbire, Mount Darwin, and Harare suburbs of Kuwadzana, Glenview, Budiriro, Mbare, South Lipak, Highfields, Glenora, and Chitungwiza. As you can see, some of the suburbs in Harare have been left out because we have very, very few cases from those areas where they have got good sanitation conditions. Let me say that currently these are the most affected areas where we will target specific wards that are reporting cases. The target age group to receive the vaccines is from 1 year and above. For this campaign, only 1 dose will be given as opposed to the usual 2 doses. 1 dose will protect the individual for at least 6 months, as opposed to 2 doses, which is a protection of above 3 years. The vaccine is in liquid form and is administered orally by mouth. Zimbabwe developed a multi-sectoral cholera elimination roadmap, that is 2018 to 2028, that spells out a clear pathway for cholera control and elimination in our country. This roadmap states the need to revamp water and reticulation systems in our cities, provision of adequate water for Harare City, which has grown and increased in sanitation coverages in our rural communities. This requires a multi-sectoral approach to eliminate cholera as a public health threat to Zimbabwe. I will not go into details because that has already been explained. In conclusion, Let me say that the vaccine is not an end to cholera, but a temporary response which should be complemented with tangible investment in safe water provision, health education on hygiene practices, increase in sanitation coverages, and elimination of open defecation and removal of solid waste. The streets need to be clean with no dumping and avoidance of food vending and preparation from undesignated areas. This is my presentation. I'm open to any questions. Thank you, Chairman.
No, that's fine. So this is the first round of questions. But perhaps in order to buttress what the PS, Comrade Mangwana has highlighted, you have to mention your name, the media house, and the question. Or perhaps you could direct the question. Say, my question is directed to the Minister of Health and Child Care. I understand this is the perhaps the first session where government meets with the media houses. But I must also appreciate that you all came in numbers to ask and seek clarity on any topical issues. And this is not the first and last. We have more and more sessions where we interact with all media houses. So the first question is coming from Tinashe Matambo from Heart and Soul. Your question is where, how, and where? Perhaps I would believe, and why? I believe this question is directed to the Minister of Health and Child Care with regards to the management of cholera. Thank you. Over to you, Dr. Mobeshura.
Thank you, Chairman. Also, thank you, Tinashe, for that question. But when you say, why did we fail to contain, where and so, I think to go back to February 2023, the first case was in Harare, in Glenview. And this is an urban setup. That's the first question you want to say, why did we have cholera in town? And I think it has been mentioned by Honorable Dr. Masuka to say the city of Harare has failed to produce, to provide clean water to the population. In short, cholera is when you have eaten your feces. So we've got best sewer contaminating our sources of water. We have bores which are contaminated, which are being used as water sources in Harare. And that's the first thing that has gone, that went wrong. Now, the other cases, as they spread, I'll talk of the second outburst of cholera, which was in Buhera. That was more related to the religious sect, which had a gathering, and at that gathering, there were no good water facilities, and sanitation facilities were poor. And people started having diarrhea and cholera in that area after the gathering. But because they did not seek treatment, they don't believe in going to hospitals, we had community deaths. And those relatives handling people who had diarrhea were also getting contaminated and acquiring the same disease from their relatives. And in our tradition, we love going to funerals. If you don't go, you are probably suspected that you've got something to do with that death. Now we saw a number of cases around that area, and then people who had gone to the funerals, as they went back to their villages, also contaminated their water there, and the disease spread to their relatives. We could trace a lot of other cases, including the Chitungwiza cases. We could trace them to Bohera. So this is why it spread throughout the country like that. But the reason, your question to say, why did we fail? We failed because we did not have proper water facilities and proper sanitation conditions in the areas. And this is why, after discovering this is the challenge, government has taken it upon itself to take over the issues of even refuse collection, which is Operation Chenesa, to clean up Harare, which is something that was supposed to be done by the city fathers. But when they failed, government has got to come in and assist. So cholera spreads like fire. By the time it has gone to your village, by the time you pick that somebody has got diarrhea, probably 2-3 others are waiting to show the signs. So this is why the cholera spread to all centers, because of poor hygiene and sanitation conditions that prevail in our urban setup. And we should not be having cholera or diarrhea in urban setups. It should actually be a disease of in the rural areas where we think there's poor sanitation conditions. But the government now has come up strong. You heard the minister saying they are targeting to have 35,000 boreholes drilled throughout the country. So these are now measures that we are putting in place to make sure that we correct the situation. Ministry of Health is just on the receiving end. When you fall sick, we don't care what caused your sickness. We will come in to make sure that you stay alive. So that's where we come in. But we have now come together and work as a team to make sure that this approach which we are now taking, we address all the causes and make sure we take the corrective measures collectively. I'm sure I've answered you in full.
Thank you, Dr. Mombeshora. Mr. Matambo, I'm sure you are satisfied with the response, but also to complement Dr. Mombeshora. The question is, who collects the revenue for refuse collection? Where do you pay for your water bills? And where also do you pay in terms of sewer? You pay to the city or the local authorities. So there is also need to appreciate the ties of government, but also the deficiencies related to local authorities in terms of water and sanitation. But perhaps let me move to the second question from Fatima from the Sunday Mail about the mitigatory measures that the Ministry of Lands has been able to provide in terms of measures of health.
Yeah.
I thought it relates to both, in terms of water provision and also to Ministry of Health. In terms of artisanal miners, especially in the Mazoe district, which has become a hotspot. Over to you first, to Minister of Health, then perhaps the Minister of Lands can also then complement in terms of the water and sanitation interventions in rural district councils. Thank you, Dr. Mambishore.
Okay, thank you, Chairman, and thank you, Fatima, for your question. Artisanal miners are a special group because they don't fit into an urban setup. It's not the typical rural setup. It's a community that is composed of people from different areas who flood a certain area to try and get whatever minerals. And in most cases, like what you're talking about in Mazoe, it's gold. But if I may recall, correct me, Dr. Piri, if I'm not wrong, if I'm wrong. In Mazoe as a district, the cases that we have witnessed were also related to funerals and not artisanal miners. The area that had the challenge with artisanal miners was in Chiazo, and I actually visited the area personally to see the situation on the ground. The challenge that we see with artisanal miners, these are people who whom we don't have records for. And in areas where they operate, it's just in the bush. There are no toilets, there are no, there's no borehole to provide clean water, and there are no houses in some cases. These people just sleep in the open, like in Chiago where we went. They are just sleeping in the area. And when you try to go into the area, they run away because they think they are going to be arrested. So what we did in Chiadwa was to talk to the police to say, can you stop your operations of arresting these people so that we can send our people to communicate with them, at least teach them basic hygiene, see how we can deal with the water, situation of water supply, so that we save lives. So we had asked them to give us a month, at least a month, where they don't go to try and arrest and stop these artisanal mining activities whilst we talk to the artisanal miners. And I think we succeeded because we are not receiving any cases from Chiadwa, although we still have some cases coming from the adjacent Boera and Marange, but in Chiadwa, the cases are down. What we don't know is, are there cases, are they dying and burying themselves without reporting or what? But I think we would have picked it up. So those are some of the interventions that we deal with artisanal miners. It's very difficult because they are not, there's no village where you say we can go and talk to the leader, to the sabuku, or somebody, nobody controls them. They are just like individuals who do whatever they want. Initially, in Chiadwa, they'd been reporting to the clinics. But when the police started arresting them at the clinics, then they started just staying in the bush without reporting. We discovered that some of them don't even have a house. They'll be sleeping in the bush. Some will be using sleeping bags and so on. But the most important thing, which I think for us, is that we should realize artisanal miners can't mine when it's raining heavily. So it could be another advantage to us now that we are not receiving many cases from there, because the rains tend to flood their Makomba, and then it's difficult for them to operate, so they tend to reduce their operations during rainy season. So we may thank these rains for actually reducing some of the cases in those areas. I think those are the measures that are. But we still try to identify the leaders, traditional leaders, to approach them and give the health education to them. Thank you.
Thank you, Dr. Mapostori. The last question comes from Tafadzwa Nyikadzino about an analysis which he carried out that 50% of bores in Harare are not safe. So I will direct the question to Dr. Masuka to give us clarity.
Thank you, Chair. I think that, well, besides the source of the information, whether credible or not, let's address the issues. Assume that the bore water that you are getting is unsafe and treated. That's the first logic. And have your water tested so that you know the actual status. That 50% of the water might be contaminated. I assume, and I just want to correct this here, it's fecal contamination, not that you found feces inside. It's fecal contamination, and the symptoms, we use various proxies to find out whether it's fecal contamination. They are what are called coliforms. And also then you go on to do the more specific tests. And if you go into a lab that is testing this, it will be very exciting that in 8 hours you'll be able to know all the results of these. So the first port of call is that assume the water is unclean and treat it before you drink, which is why all the boreholes that we are now drilling in Harare, we are attempting to put in at least 4 tanks, and so that we can put in aqua taps, so that that water can settle for 8 hours before people can come and utilize that water. Would you rather have water or no water? You would rather have water. So we prioritized as government accelerated drilling of boreholes, and we've given the Harare Metropolitan Province a dedicated drilling rig so that they can drill in those areas that the city's water conveyancing cannot reach. And Greater Harare now includes Norton, Chitungwiza, Epworth, and Rua. This is where we are prioritizing. We met with the mayor of Harare and the chairpersons of the local authorities. They are now in the process of assisting us with the areas that we are going to be prioritized in terms of drilling of boreholes. So, if the question is to drill or not to drill a borehole and ensure that the water is treated. Thank you.
Thank you so much, Dr. Masuka. We now have the second round of questions. Ladies.
I want to leave in 5 minutes if they get direct to their questions.
Sorry, Honorable Ministers, we noticed Dr. Jones from the City of Harare Health Services, I think you're the Director of Health Services, is here. So you may also help when if needed.
All right, no, thank you. The second round, so we have more of the ladies, okay? All right, I'll start with the...
Thank you very much. My name is Gwen Mukauri from Star FM. My question is directed at Minister of Health and Childcare, Dr. Magaya. I just wanted to find out, sir, the cholera vaccines, how safe are cholera vaccines for pregnant and lactating mothers and other people with specific or special medical conditions? Thank you.
For?
Special medical conditions.
Pregnant and lactating mothers, plus other people with special medical conditions.
Okay, that's the first question. The second lady.
Minister of Health, can you confirm that Zimbabwe's vaccination drive will start on the 29th of January, and how long will the process likely take?
Al Jazeera. Oh, all right, you are Hanzinduaro. The third one.
Given that there are plenty cross-borders who go into Zambia, statistics that are coming in from Zambia, is there any chance that the borders there might be restrictions in our borderline?
There.
Will there be restrictions?
Okay. Mvunzo wako unonyotsobuda.
There's a lot of traffic between Zambia and Zimbabwe. I'm saying, will there be restrictions at the border, given that Zambia is also going through cholera and their statistics seem to be higher than ours?
Okay. All right. I'll allow any questions related to the Minister of Lands and Agriculture because he wants to leave. PS will allow other questions related to him so that he can also leave.
If you're raising your hands,
Related to lands.
Wash or...
Yes. Yes.
Oh, it's a next round.
Okay, my name is Taji Silvaza from Zimbabwe's television network. So sometime this month you mentioned that when you have adequate chemicals for water source in Lake Chivero, you will close Manyuchi to repair the 4 remaining pumps. So is the 1.6 million allowed by the government sufficient enough for these works to commence?
Okay. Yes.
Now that you have mentioned that the cholera Mercy Madam Zetian Prime.
Zetian.
Yes. Now that you mentioned that the cholera vaccine is just just a temporary measure, what progress have you made with the chloride dioxide plant?
Okay. The ladies, Vapera. We can go for the men now. Oh, all right. Bananza akagara. Aiwa, no. Sorry. Okay, this is social amenities. So, director, you can
Local government and
local government, you can deal with that one.
For Dr. Masuka.
For Dr. Masuka.
There's two.
My name is Panache Mapufa from Sources Media.
Panache?
Mapufa. Before I would ask let's put the report so my my question is related to Dr. Masuka. We have research says that we are having levels of underground water and you're saying you want to do more especially in Harare. Are we not going to have a situation where you do more balls but our balls are shared?
okay. Let's make a start.
Any other question related to Dr. Masuka before he leaves? Oh, all right. The late.
Dr. Masuka, you mentioned that 80% in your purification or in water treatment processes, 80% of the water becomes wastewater. Can you just further clarify what you mean by wastewater? Because we thought water is. What you mean when you say 80% becomes wastewater?
Chisoko, can you bring a chair for Dr. Chonzi? Yes.
Thank you. My name is Cretina Machibura from China News Agency. Yes, Minister Masuka, you spoke about the plan to increase water production for Harare from around 300-something megaliters per day to over 500-something thousand. I just want to find out how exactly do you intend to increase? Is it about you repairing pipe leaks? Is it about using water-protected chemicals to reduce the amount of water that is produced? How exactly do you intend to increase that water and over what period of time? When are we really looking at changing those 500, more than 500 liters of water?
Sorry, sir.
Yeah, let's make a
If you are
start.
not pregnant and you have no medical condition, please can you give up your chair for the director?
No?
No.
Yeah, it's coming.
Oh,
It's coming.
sorry, that's right. Well, we want you to come forward.
All right. Okay, first, my sister from Kwaedza. And I'm now going but I know to know about Kwaedza. But at the same time, let's allow the Minister of Lands, Dr. A.J. Masuka, to respond to all the questions that you have asked so that he has got another assignment. We can allow him then to leave. Then we can deal with the rest of the officials.
Well, thank you
So
very
Dr.
much, Chair. We had said 1.5 hours from 10 to maybe 11:30, but I do have an assignment at the National Defense University at 11:30. So my apologies, I would have wanted to interact with you more. My email is journalistagreekminister2020@gmail.com. So let this conversation and questions continue beyond that. My cell number is 0772 169 957. Do not phone, send an SMS. 0772 169 957. Harare, when do we get to 120 megaliters a day? The 120 megaliters a day is determined by the capacity of the two treatment works, Prince Edward and Moto Jeffrey. So when they are operating at full capacity, their daily production is 520. That is what we want to get to. We had hoped to get to 520 during the first 100 days. That was not possible because some clarifiers at Moto Jeffrey required repair. And I think the first lot has been done, and we were going to see an additional 75 megaliters a day. Prince Edward was not able to generate more because we ran out of water. We've released water upstream, and so we're beginning to creep up. And so watch this space. We're going to be increasing to that. Yes, if you get a liter, 800 mils is actually subsequently found in wastewater, either through the toilet or some other bathing. So we are saying that water is what we are releasing as Harare and is going into Chivero untreated, which is why we are using more chemicals to treat the Chivero water, which is why we wanted to keep Dalwendale open for longer, because it's not as polluted. So you can get water and dilute and then treat at Morton Jeffrey. The 4 pumps with this money that we have requested from Treasury of the 13 million that is prioritized within that amount, and I'm hoping that this technical committee and the city of Harare will be able to work steadfastly to increase the treatment and ensure that everything else happens. What underground water, yes. I wanted to link this to the other. Chlorine dioxide, yes, the plant is there, we visited. It will be operational very soon, and hopefully within the 100 days that we have extended for this committee. Underground water reserves, which is why the law says apply to Zinwa or the ministry if you wanted to abstract water through a bore. They will be able to indicate it to you which other bores are within that vicinity, but more importantly, the depth at which you should be drilling so that you are able to get the water. Yes, if you look at the other countries that started bore drilling, you see that with climate change, the underground water levels recede. We put in place now a technical team to be able to monitor all water using modern methods, telemetry and all that. But that is now at this stage not the worry. The worry is to be able to do bore drilling, and that bore drilling must be informed by science and must be informed by the regulator, so you do the right thing in the right place. The 1.6 million, yes, is not for the Darwendale issues. This was simply for procurement of treatment chemicals that were to last Harare 4 weeks. The additional 13 million that we have requested and prioritized to say the first tranche ought to be 4 million US will go towards these pumps at Darwendale, which will enable us to pump additional water to Chivero, which will enable us to reduce the cost of chemical, which will enable us to use chlorine dioxide to reduce further the cost of treating water, which will make the Harare water more affordable, and hopefully as we increase the quantities, we will all be able to bath 3 times a day. Thank you very much.
No, thank you, Dr. Masuka.
We local government itasira, we local government ndiwe ma-developers kuti pavanogadzira dzimba idzi dai vakwanisa kuita zvikwanisiro zvose zvinenge zviripo izvozvo totenderana nazvo, saka chisirgai sara vachitutsira vachipedzisa datenda chaizvo.
Director of Social Amenities, we can allow Dr. Masuka to leave then.
Thank you very much.
Yes, he is going to complement what Dr. Masuka has already highlighted. Director, go ahead.
Once again, thank you, Honorable Minister. Since this is quiet, do you prefer that I speak in vernacular or I just continue? That's okay. From a mandate point of view, the Ministry of National Housing and Social Amenities basically is mandated to provide modern, affordable and sustainable plus orderly settlements throughout the country. And coming from that perspective, one would naturally expect all our settlements to conform in terms of the basic services that ought to inform a settlement. Some of those tenets include roads to a certain specifications, water availability, portable, your conveyancing systems, your trunk, on-site services in their broader context. You have two levels for enforcing and ensuring that this social infrastructure is emplaced. At government level, through a sister department in the Ministry of in the Ministry of Law, Government and Public Works, we have a Department of Spatial Planning, which is the overarching authority in terms of enforcing development control through local authorities, their surrogates. That's a lower tier of government. You know, you have government and local authorities at that level. I need not mention the other level, your provincial council. That's a bona fide tier of governance for this country. But having said that, it is also incumbent upon our would-be abode seekers, house seekers, stand seekers, to approach relevant authorities that give correct information about whether one would want stands. You are aware that we have this cage of land barons, which has been an albatross around the necks of our local authorities and government at large. It's an area which government is currently seized with through the whole of government approach. Our ministry, national housing, local government, small and medium enterprises ministry, and other key government agencies are in the loop in terms of trying to address this scourge, to the extent that the problem which we are talking about, it exists, but government is currently seized with trying to address the scourge. But once again, we urge that people ask relevant questions pertaining to the built environment to the relevant authorities that I've alluded to. I think I can leave it there.
No, thank you so much, Director. The rest of the questions are related to Dr. Mompeshora. The state of the rollout of vaccines, the safety of cholera vaccines, especially for pregnant mothers, and also if there will be any traffic restrictions that will be put in place in order to try and slow down or try and stop the spread of cholera between Zambia and Zimbabwe in terms of health policy. Over to you, Dr. Mompeshora.
Thank you, Chairman. The first question was about the safety of the cholera vaccine. This is not a new vaccine, and it has been used all over the world. The only reason why we don't have it enough is because it's manufactured on demand. Therefore, it's the same vaccine. It's very safe. It's very, very safe. We have not received any reports of any adverse effects in our past use of it. I've had the cholera vaccine before, I can't remember when, years ago. Nothing to worry about. The second issue is how long will vaccination campaign take? We cannot give you a date. Remember, we said we are going to receive the vaccines in batches. So as we receive the vaccines, we will be vaccinating the communities. If we receive enough to vaccinate the whole country, the better. But we don't know how long it will take. So the first batch is 890-something thousand doses. As we are, today I received a letter from WHO promising that they will continuously supply us with the vaccines until the situation is under control. To say when, I can't, but to say we will vaccinate until the situation is under control. That is the answer that I can give you.
Minister, sorry, you are starting on the 29th?
Yes. Because when we receive the vaccines, we now have to organize and train the people who are going to administer the vaccine, and also map out the country where we are going to start, where we are going to go, As I said, it's not the whole country, but we have to identify the specific areas where we go to. The last question was about the border.
Yes.
Yes, the border with Zambia. There is no need to close any border, but to monitor the movements that take place there. We have got health posts at all our borders, except maybe the very small ones along Botswana, somewhere in the park there, and some in Manicaland and Chiredzi South. Yeah? Sango area, yeah. So those are the very small ones, but they are not very busy. But let me tell you one thing: if you have got cholera, real cholera, you can't move, because otherwise you are just. For those who have gone to a cholera treatment center and see how we manage those patients, we use special beds with a hole where somebody will have the buttocks there, totally naked, so that when nature calls, it just drools like that. You don't have time to go to the toilet. So you can't be traveling and having time at the border post when you have cholera. So we don't expect many people with cholera to be traveling. But our borders will be screening. We've got our health post there that will be screening. Just like we did not close schools. Because we said, if you go to school and there are proper sanitation conditions there, then it's safe. It's unlike COVID, where we say you cough and then the next person gets it. So I think there's no need to close any border.
Okay. Thank you, Dr. Mambeshwar. Now we have the third round. Okay. We'll start. So, Dr. Chonzi, you will respond to this question. I am sure you were paying attention to this particular question about the selling of food in the city of Harare, the 10-day plan, and any plans that you might be having in order to augment the central government's plan in order to have Chenesa Harare as a success story. But the question is mainly focused on the selling of food within the city of Harare. What you are doing in order to arrest the situation.
Thank you very much, Honorable Minister. Yes, an order was given for us to get rid of all the food vendors in Harare and to make sure that our streets are clean. But as you may have seen, we have not done very well there. I think the general economy is playing against us. We have been doing this hide and seek chase after vendors. It has not been working. We are glad that government is coming now with Chenesa Harare, where at least if we clean up for now, then we come up with medium to long-term plans to maintain the clean environment that is there. We are happy. I think we've been given daily updates, in fact, hourly updates of how we are doing in terms of the Chenesa Harare. But to tell you the truth, as Director of Health, I'm not happy with the vending situation in the city. It is playing against what we're trying to achieve as we try to contain the outbreak. And this trying to enforce is not really giving us the intended results. What we may then have to rely on is a complete mindset change where people know that if you buy food from uninspected premises, if you buy food from anywhere and everywhere, the chances of you contracting not only cholera, but typhoid, dysentery, and other diarrheal diseases are very high. So we are actually appealing to the communities themselves. If you think you are saving $1 by buying your son food from uninspected premises, you then find yourself spending much more taking that child to a hospital or to a doctor. So I'm just appealing to the general public to know, I think this is our issue together. It not necessarily a City of Harare issue. Yes, we have failed, but look, let's let's work on this together. Minister, thank you very much.
Thank you, Dr. Chonzi. The second and third question relate to the Minister of Health from ZFM. That do we have any hope to eradicate cholera? And the interventions by other international organizations which include UNICEF in terms of the rollout plan. Dr. Mombeshwara.
Thank you, Chairman. I think cholera can be eradicated, but not to say there is no cholera case in the country, because it's there in the world, and as people move, they will bring it back here and there. But to control it, to have very few cases, not the magnitude that we are seeing, it's very possible. I think what we heard today, explanation from the Minister, Dr. Masuka, what I've said are all efforts to make sure that we contain all infectious diseases, all diarrheal cases, because they are more related to good hygiene practices. So it's very possible. You all grew up, probably, most of you, without knowing that there is cholera, without knowing typhoid. So it's still possible. If we put our house in order to make sure that our cities are clean and they've got safe water, then all these things will disappear. I think it's very possible. The other question was, what's the role of partners in vaccine provision, including UNICEF? I think these are our development partners, and they are very key to us, especially in the Ministry of Health. We work with them almost on a daily basis. Even the planning, like I said, there's a shortage of vaccine, and it's now controlled through WHO and UNICEF. So all our applications, we are working with them to make sure that they also authenticate the information that we are using to apply. And it also brings another player, Gavi, which is responsible for production of most of the vaccines that we use. So we work with them. Even when we roll out the programs, you will find that they will be present. They also have people in the districts working together with our teams. So we don't separate each other. We don't separate WHO, we don't separate UNICEF from us. They are our partners. And they play a very big role, especially in supporting us to get the numbers that we want for the vaccines. If they had not supported us, questions keep on coming. You answer, and yet the disease is going on. But once they come in and also put their supporting letters, we find that everything goes on smoothly. So we are working together very well. Thank you.
Oh, thank you, Dr. Mombeshwara, for the lucid response. But at the same time, to thank you all members of the 40 states, your media organizations, for coming to the government ministers meets the media session, which is very important, which will continuously